My name's Lucy Leonard. I'm an occupational therapist and director with the OT service.
And I'm Adam Ferry, occupational therapist and director of the OT service. And in this session, we're going to be talking about plus-size clients and toileting. Now, Lucy, the title itself, plus-size clients and toileting, let's start with that discussion, because language is incredibly important in whatever topic we're talking about. But in this topic in particular, given people's perceptions of language and how it's used and sensitivities around that, it's a topic that we need to be even more aware of, isn't it?
Certainly, yes. I find that using positive language is necessary, and so I like the term plus size because I find it a really positive term. You might hear a lot of people saying bariatrics, which for me is quite medicalised because that is around the study of obesity. So I find plus size is a nice sort of catch-all term. And I think it's also important to talk about body mass index, because the definition of obesity is a BMI, body mass index, of over 30. So also when we're talking about plus size clients, we can also refer to BMI because they are factual terms as well.
Yeah, it's really important. Have you had any experience of using language at the client's choice that you might have yourself felt uncomfortable using in terms of mirroring what they're saying and they're comfortable with?
Yeah, I mean, I've worked with many plus size clients over the last 20 years or more, and when you listen carefully in an assessment, people will refer to themselves in certain ways. So I've worked with women who've referred to themselves as curvy or plump or cuddly, you know, and a lot of these terms are really positive. And so if I feel it's a positive term, I will use that as well during interactions with the client. But I would never use a derogatory term, even if my client was to say that about themselves.
Yeah, and I think that's important, isn't it? It's what one person might deem to be derogatory, or what one person might deem to be safe is another person's derogatory, and there's nothing wrong with even asking that question, or like you say, mirroring what they say. Yeah,
especially when you're trying to establish a rapport and you might be moving on to discussing intimate aspects of somebody's life. It's really important that language is very carefully used and thought about.
Yeah, it's a really important point to make first up. But then I suppose from an occupational therapy perspective, the issue often isn't about weight, is it? It's, yes, we need to know weight limits sometimes on equipment or on adaptations, but actually from an occupational performance perspective, the thing that is, in my experience, more important to see is weight distribution, where somebody is carrying that weight and how they're carrying it, because that then impacts on how they perform tasks, and whether that's different to how you and I or anybody else might do that.
Yeah, there's something called anthropometrics, which is measurements of the human body. And what I would say is it doesn't mean you necessarily have to get your tape measure out when you meet somebody, but it's about looking at people and understanding that we're all so different. Human beings are so different. And it's about that bell curve, you know, there's going to be the top 5% of people and the bottom 5% of people. And most of us are somewhere around that middle of the bell curve. But there's going to be people who carry their weight differently, like you say. Women generally tend to carry their weight around the middle, around the hips and the bottom. I've worked with a lot of men who carry the weight at the front. And so it impacts all sorts of things like your centre of gravity, how you carry it out in occupation, how you sit. If somebody has a large panniculus, which is the weight at the front of the body, they might have to sit with their legs open, which can then impact on all sorts of things, especially toileting. So absolutely, it's not just about reading some information about somebody and seeing their weight or their BMI. It's about understanding that person as an individual. And again, it's that client-centered holistic assessment that we often talk about. But it's really important to understand how that person's weight impacts on their function.
Yeah, so let's think about that in a bit more detail. And if we need to make sure we're not making any assumptions, first and foremost, about how somebody does something that we've mentioned in previous sessions. But if we take, for example, something like a bed transfer, how somebody might otherwise sit on the edge of the bed, and what we might think of teaching somebody as a standard technique: sit on the edge of the bed, turn to 45 degrees, and then use that kind of momentum as down and leg up, swinging up into the bed. They're the sorts of things that might be very different for somebody who carries that mass somewhere else. So I'm thinking about, when we've delivered moving and handling training, and we're thinking about how does that person who has more mass around the bottom and around the waist, when they're sitting on the bed, how do you avoid that being a perch? How does that person then swing their legs into the bed when they've got more of that body mass behind them that's being spread because of the pressure in sitting? And it might well be that that person chooses to crawl onto the bed, for example, and then turn. And it's making sure we don't make any presumptions about how somebody's doing something, but also have any preconceived ideas about what we think is necessarily right or wrong.
It's really important, isn't it, to understand that person as an individual and observe them undertaking transfers to see if you can get an idea of how maybe they're going to struggle with toileting, reaching, and that activity analysis is really important.
So we talked about activity analysis in a bit more depth in the last session we did about who would benefit from a washed-right toilet. But I think it's really important to reiterate that within this session, that the activity analysis is really critical to making sure that our recommendations are robust and client-centred. But I think it's often a referral, in my experience, for somebody who's plus size, that it can be quite daunting for the therapist, whether that's about anxieties over language or something they haven't seen before in terms of different postures. I'm not quite sure, but I think it's important as a starting point for us to think about how occupational performance is affected in what might be a different way that affects other client groups.
Yeah, I think being plus sized comes with its challenges. I've certainly worked with people who are plus size who experience high levels of fatigue because they are carrying more weight around. They can get shortness of breath, which obviously then impacts fatigue as well. And sometimes, if you've got a very high BMI, just engaging in normal activities in the community can be a challenge. So I've spoken with people who express frustration at not being able to undertake chosen occupations such as attending the cinema or sitting on a train because they're finding that the environment doesn't meet their needs because they have a high BMI, and they can feel quite uncomfortable. So being plus size can impact on all areas of life, and that's something that we need to consider as occupational therapists, especially when we're thinking about daily activities such as toileting. It's a really important aspect of independence.
So in other sessions we've reiterated how everything that we do should be holistic, client-centred, and should ensure that we're considering toileting as either a purposeful or meaningful activity, depending on that person's goals. But let's think about the impact on toileting specifically for this session. In your experience, what are the main challenges for somebody who might be plus size with toileting?
I think one of the main issues that I come across is the ability to reach to wipe after using the toilet for people who are plus size. And as occupational therapists, using a problem-solving approach, we might offer different solutions. Can the person stand up to wipe rather than stay seated? Can they wipe from the front? But a lot of the time with plus size clients, it just becomes very, very difficult because of the mass around the centre of the body, especially when they're sitting down, because often when you sit, your weight is distributed differently. So I find that a lot of my clients and patients that I work with struggle to reach to wipe, and that can be a real challenge. And the simple solution is the provision of a Closomat toilet in that instance. But there's so much more to it than that. It's about making sure that the wash-dry toilet meets their needs, and are they able to sit safely on that toilet. Closomat will undertake a joint visit with one of their product specialists to have a look at the environment. And I have used a Big John seat before now, so that is a seat that's designed for plus size clients, and the great thing about it is it's slightly wider where people put their legs, so it gives them a little bit more support, so it really meets the needs of plus size clients. I've mentioned the paniculars before, but a lot of the clients that I work with have to sit with their legs open, so that Big John seat, as it's called, provides a lot more support posturally for people.
Okay. One of the questions we've been asked in the past is about how you manage somebody with that kind of paniculus or mass when with the space between themselves and the system in terms of their inability to adjust their posture to allow those things to happen. What kind of your response be to that?
Yeah, I've worked with people who have a large gluteal shelf, which means that they have to sit slightly further forwards on the toilet, and that can mean that the spray doesn't meet the right places. But working again with the product specialist, they recommended a longer douche arm, so that was able to come out further and hit the right spot, if you like. So, you know, it's always worth speaking to a product specialist from Closomat who can work with you to problem solve, because the Closomat is very adaptable and adjustable. And what's really important with plus size clients, when there's a lot of skin, the strength of that wash is really important, because to hit the right spot, it might have to go past some skin, so that the strength of that wash, and I know the Closomat delivers about 8 litres of water per minute. So that's really helpful when working with plus size clients, to make sure that they're actually getting washed and dried where they need to.
It's really important to know the product, isn't it, when we're making recommendations, but nor can we be expected to be product experts.
No.
So I think it's about us being able to apply that activity analysis, determine what we think the need is with the client, but then using the product specialist to say, this is what we think, how would you help us try and problem solve that? Whilst acknowledging that we can't know everything and that the product specialists are there to help us meet an identified need. But I think we also need to acknowledge that it isn't always about being able to wave a magic wand.
No.
So that question of how you would support someone with that gluteal shelf, given the proximity to the cistern, it could be that that is a challenge in some circumstances that just can't be resolved.
I think the approach to working with plus size clients is often compensatory, so the provision of equipment and adaptations, but it's also important to consider other approaches to managing being plus size, whether that's working with a multidisciplinary team, looking at education, looking at a coaching approach. So I think that combined approach to being plus size is really important, and occupational therapists are able to work in different ways with plus size clients.
Yeah, and I think that leads in quite nicely to the idea of holism as well, and that if we went back to that person with the gluteal shelf, where it might not be the right solution across the board, it might work to a point, but you might feel like there are elements of it that aren't doable because of the proximity to the cistern, then because you're thinking holistically and you're thinking about the other aspects of life and other adaptations, that would likely factor into something else like shower space or something like that, wouldn't it? Yeah. So you're thinking about, I can resolve some of this here, but actually I'm going to need to look at what else I can do for that person to resolve the whole issue.
So when we're recommending adaptations for plus size clients, I often get asked about adaptations on the first floor and the impact of equipment and adaptations on the first floor. Have you had any experience of this?
Well, it's certainly a question that came up in a webinar and since. And I think the honest answer is, and it kind of alludes to a previous answer, is that we're not experts in everything. And if there is doubt or there's an issue with first floor installation, then we need to be working with architects and product specialists to work out whether that's feasible or not. We're not builders, we're not architects ourselves, so we're identifying a need. We're not going to be the people who say, yes, you're going to be able to install that in this first floor. So I think that sounds like it's a bit of a get out clause, and I'm not trying to use it as one, but I think we need to acknowledge our remit and our roles. So I'm never going to be in a position where I'm going to say to someone, yes, that installation is going to be absolutely fine on your first floor, because I haven't got any idea whether it is or isn't. We work as part of a team, so you get those architects in, you talk to the product specialists about their experiences. They're the ones who ultimately have organised these installations in the past. That would be my simple answer.
Yeah, I think it's about acknowledging the limitations of our role sometimes, and not taking on something that isn't purely occupation focused. And if it is around building, we have to default to people who know more than us in that aspect.
Lucy, do you have any clinical examples of how you've used a wash-dry toilet for a plus size client?
Yeah, I've used it with a number of clients. I'm just specifically, I can remember one gentleman, he was still working as a courier, and he was a plus size client and carried a lot of weight at the front. And specifically with him, he was struggling to wipe because he wasn't able to shift his position safely on the toilet. And actually when I went to him, the toilet had actually become loose because he'd been trying to sort of shift his position, and changing the centre of gravity was changing his posture, and he was getting a lot of back pain. He was a really open and engaging client, and he was quite happy to discuss his difficulties with toileting with me, which made my assessment a lot easier, and we were able to chat very openly about the difficulties that he was having. And straight away I knew that the only solution was going to be the Closomat toilet. There was nothing else I could do because of his size. And actually he was quite happy with his size because he was quite functional. He was able to engage in vocational work, had a great social life. So really, specifically, it was around toileting was his issue. And so we just installed the Closomat toilet with the Big John seat, and he was able to undertake toileting independently and attend to his personal hygiene needs a lot more efficiently and effectively.
I think it's really important that you talk about this gentleman being working age adult and in active employment, because I think we often have these preconceived ideas about a number of people with perceived disabilities. It's really important for us to remember that just because somebody has challenges in a certain area doesn't mean that they're not being productive or functional in other areas. So in this case, for something like personal hygiene to be an element that supported him within work, I think is a really important thing to consider when we're ensuring that the assessment's holistic and client-centred. We shouldn't be presuming that the person has so many needs that they can't contribute in many other ways. Yeah,
I think it's important, isn't it, that, like you've mentioned before, you get a referral for one thing and it can end up being occupational therapy intervention across, lots of different activities. But with this gentleman, he was living a really full and fulfilling life. Regardless of the fact that he was plus size, his health and well-being to him was optimal. So it was great that we could just give a little bit of intervention and support his the occupational toileting and his independence.
Yeah, that's really important. So we've covered again quite a lot in this session. So we've gone through again that importance of activity analysis, client-centred and holistic assessment. But what have we covered within this session to summarise specifically within plus size and toileting that you want people watching to take away?
I think the importance of understanding how somebody carries out an occupation and the barriers to that, especially with being plus size. So remembering anthropometrics, so somebody's shape and size and how that affects their function, their posture, and just about having a look at somebody and having a chat and having that open conversation, using the right language, building that rapport and getting them to share that vital information to make sure that you can assess in a holistic manner.